Welcome back to Vital Signs. If you're just tuning in, you're going to want to go to nowmedia.tv, click on shows, go to Vital Signs to catch the first half of today's episode. It has been completely epic, and we're going to shift gears a little bit. We often hear about how sleep impacts our energy or our mood, but what if it's also affecting our hearts? Today, we've got our resident expert, Dr. Yassir Sonbol, back with us to explore that powerful and often overlooked connection between sleep and heart health. Welcome back to the show.
Hey, thanks for having me back.
Okay, Dr. Sonbol, talk to us. Does poor sleep increase risk of heart disease?
Sure. I mean, it depends on what context you're putting it in, right? So, people that have sleep apnea, where they have a lot of snoring or actually stop breathing at night when they sleep, that has been shown to be a marker or can, increase your risk of heart disease. Um, Obviously, sleep in and of itself is very important, and it's not just for the heart, it's for everything, right? I mean, your body needs a time where it rests and it gets adequate, regeneration of cells and sleep. And, there's a lot of things that happen overnight in your digestion system and, just your circadian rhythm. It can cause all sorts of hormonal imbalances, etc. Um, and so sleep is very important, and it can, obviously lead to a lot of bad problems later on if you're really not getting enough sleep and enough rest. But from a heart standpoint, yeah, especially when people have sleep apnea, which is a very underdiagnosed and undertreated disease, I think. There's a lot of people that just don't realize it. And so, one of the symptoms they may have is that no matter how much sleep they get, they just always feel tired. And that could really be a sign of somebody having sleep apnea.
So let me ask you this because I agree. A lot of people don't recognize that they have that, and we've seen that even in athletes where they have issues and didn't it was undiagnosed. But if someone's dealing with a sleep disorder, if maybe they are waking up and they're never rested, even though they're getting the hours, or they believe or suspect they have sleep apnea, or even are diagnosed with sleep apnea, what is the first step you recommend that they do so that they can get moving on this? Because it definitely leads to a whole host of other challenges.
Mhm. Sure. I mean, so, one of the things I encounter quite often in my practice is people come to see me because they're short of breath. And sometimes a lot of people, obviously it's a alternative symptom to heart disease. So it can be a sign of people having a blockage, a valve problem, etc. So a lot of times sleep apnea is really a diagnosis of exclusion, but part of the history that you take is you ask people, if they snore at night and if anybody witnesses them stop breathing in the middle of the night, or if no matter how much sleep they get, whether it's 8 hours, 10 hours, 5 hours, they still feel tired no matter what. And a lot of times just that part of the history can be a, red flag that somebody may have sleep apnea. And so the treatment for that is really, first of all, they need to get a sleep study. So what happens is they kind of get watched overnight while they sleep, and this thing tracks, how much they're breathing, how much they're doing stuff, et cetera, whether they stop breathing, what's their sleep apnea level. And then based on that, there may be a recommendation for what's called a CPAP machine. So it's this machine that kind of blows air into your lungs while you sleep. And so sleep apnea is not necessarily a lung problem. It's really a problem of your tongue just kind of falling back into the middle of your throat and blocking your airway at some point. And so, if you wake up a lot in the middle of the night because of sleep, you may have sleep apnea. It's because your brain is waking up because I need oxygen now. Like I've cut out my oxygen level. And so that's always, the biggest sign. And so once they get the CPAP machine, if they wear it, a lot of times their symptoms resolve. They're not short of breath. They're getting restful sleep. They feel a lot better. I mean, my own brother has sleep apnea, and I could tell you from his quote was, I've never felt better till after I got my CPAP machine.
Oh, I'm sure. And I've seen the same thing in sports medicine. So if you think you might be having this, the take home, folks, is if you're getting the right hours of sleep and you never feel rested, definitely look into this because it impacts so much, including your heart health. But let me ask you a more general question. I want to dive deep just because you mentioned it, and I agree with you. It's something that's lesser known, is sleep apnea. But what are some of the biggest sleep mistakes that you see clinically that directly impact people's cardiovascular health, maybe with your patients or whatnot who come in if they don't have, for example, sleep apnea?
Well, I mean, obviously, lack of sleep can lead to a lot of things, right? I mean, it just increased fatigue, chronic fatigue. You can throw your cortisol levels off, which can lead to weight gain, which can lead to shortness of breath, which can lead to other symptoms, can lead to swelling. And so all those things can affect the heart from a hormonal standpoint, just in the sense of, it increases the sheer stress on your body, just the lack of sleep in general.
And one of the things that we definitely don't want to do is increase our stress. We've got not enough of that in our lifetime
Right.
today. So, for someone who's watching, maybe someone who wants to protect their heart, what are some of the most impactful changes they can make that could improve their sleep quality and maybe help them along their journey so that they can be more healthy overall and take some of that stress and strain off of their heart?
Sure. I mean, I think it's really important, just like anything else that we factor in for time of the day in our lives, we should factor in time to sleep in our lives, right? And so I think a lot of us are like, well, a lot of people have the mentality, I'll sleep when I die, right? I mean, that's the mentality, but that's not really the right answer, because you really need to tell yourself, you know what, I really need to get, some people just don't need 8 hours of sleep, right? I mean, I think for some people, 5, 6 hours may be enough for them and they're okay. I mean, we're all different in that capacity. I myself can sleep maybe about 6 hours and I'm good for the day and I don't feel tired. Less than that, I probably do. More than that, sometimes I still feel even more tired. But but I think that's really important to tell yourself, set a bedtime, and especially nowadays with the amount of electronics that we all use, right? We're all staring at our phones, our iPads, our computer screens, whatever else we're doing. It really kind of disrupts our circadian rhythm, and it disrupts our, shutting our brain down for a while so that we can sleep. So there's good things to do is, an hour before you want to sleep, it's a good time to just kind of decompress and just shut down and, let your mind just kind of slow down and be able to relax. Um, Obviously, some people just need help sleeping. And so sleeping agents aren't a bad thing. There's a lot of over the counter stuff that people can use, whether it's Benadryl, whether it's a Tylenol PM, whether it's, ZQuil or any of these things that are not addictive, don't require a prescription, and don't really have a lot of adverse effects. But when you do take those things, you really need to plan that you're going to get a certain amount of sleep, because if you don't do that, let's just say you take it at midnight knowing you're going to get up at 5 in the morning, well, you're going to wake up feeling really groggy because the effect is still there from the medicine. So I just think it's really important for people to factor in how much sleep they need and adjust their schedules to factor that into their schedule.
So I know people are thinking, oh, that's great, doc, but I live a busy life. I've got kids, they're in sports, they're doing all the things. I have a job. You yourself, you're a busy individual, you're a physician, you've got patient care, which I know keeps you up at night. No healthcare professional under the sun doesn't think about it on their downtime. How do you balance all of those things in your life so that you can get the sleep that you need and take care of you? Because quite frankly, if you're not healthy, you can't take care of your patients, you can't take care of your family and do all the other requirements. So how do you manage that in your life?
I mean, I follow what I say, right? So I try my best to make sure that at a certain time every night, I say I'm going to go to bed. Let's say during the week, I say to myself, I'm going to bed at 10:30. That's my bedtime. So at 10:30, I'm zoned out. I'm ready to lay down and go to sleep. Sometimes, I just lay there until I fall asleep. Sometimes whatever, but I set a time because I know myself that no matter what happens, I have kind of this internal alarm clock. I wake up at like 5 or 6 a.m. every day, and so I try to make sure that I go to bed at a certain time so that I ensure myself adequate enough sleep, regardless of how busy my schedule is, regardless of what's going on in the day. Obviously, some days you're going to end up being up later. Some days I get called into work and that gets disrupted at night. But, those are off days and they're not every day. But on the days I can coordinate it, yeah, I make sure that I go to bed at a reasonable hour and, set myself a time limit.
And let me ask you, have you ever had a time or have you ever experienced this, or what do you recommend? Because this is a question I get a lot. What happens when you just can't turn your brain off? Do you have any suggestions for those who, when they lay down, that's when their brain becomes active and is impacting? Have you ever experienced that, or do you have any advice for people who might be watching who fall in that camp?
I experience that all the time. So that's not unusual, to go through your day at the end of the day and start thinking about things that you didn't have time to think about throughout the day or decided not to because you're busy doing other stuff. Um, and in that situation, when I feel like that's going to be one of those nights, sometimes you kind of know if you're stressed before you go to sleep, that's really the time that where your brain is running at night when you try to lay down. And sometimes you just plan ahead that those nights you might take something to help you sleep to kind of take the edge off, and just kind of zone your brain out. And I've done that at times when I could, because take a Benadryl or, take a Tylenol PM or something and just say, let me zone myself out to fall asleep. And so that's the best you can do. Sometimes meditation before you go to bed, right? That's another thing. We've talked about, I'm a very spiritual person. I'm a Muslim, and so we pray. And sometimes when I feel like it's going to be one of those nights, I will stand and pray for, 10, 15 minutes before I go to bed and just kind of ask God to, give me the peace of mind that I need. And so there's no right or wrong answer here. It's just whatever you can try that works for you that ends up helping you. That's what I would do.
Fantastic and sage advice. Remember, folks, that everything on this show is for educational purposes only. Please make sure you consult your healthcare practitioner before adding anything to your routine. But the moral of the story is sleep is your heart's recovery time. Protect it like you protect your diet or your workout schedule. It needs to be something that you honor. We do have to take a brief break, but we will be right back after these messages.